Between the 1st to the 14th of July, Namibia exceeded 100,000 cumulative positive cases and more than 2,000 people have died of COVID-19 complications. This means that Namibians have to bear the lockdown of all 14 regions, the 9 p.m. to 4 a.m. curfew, as well as the restrictions related to the sale of alcohol and 10% limit for public gatherings for another 16 days.
Notwithstanding the countrywide tightening of restrictions aimed at suppressing the spread of the disease, the rate of transmission and positivity ratio remains high, averaging 41% over the past 2 weeks. This situation, left unabated, can become unmanageable. We can therefore protect our healthcare system from becoming overwhelmed by reducing the rate of transmission. We protect our own lives and healthcare system by social distancing, keeping no less than 2 meters between persons in public spaces, wearing a mask, face mask, washing and sanitizing our hands regularly. The disease does not move. It doesn't move unless we do. We are the ones who walk into it, which increases our risk of walking into it because we don't stay at home. So please avoid unnecessary movement and please stay at home.
The Thomas region appears to be regaining the epicenter status as it accounted for the highest share of new cases at 20% over the past 2 weeks. Erongo region is second with 15% of new infections, while Oshadonjuba and Oshana regions each recorded 9% share of new infections. Of concern, however, is the death rate among the senior citizens, as a staggering 414 persons aged 60 and above succumbed to COVID-19 so far.
Notably, 29% of fatalities during this period have occurred in Thomas region, followed by Erongo, Omaheke, Otoronjuba regions, and it is important to highlight that 55% of fatalities were recorded among people above the age of 60 years. Let us therefore shield the elderly and vulnerable members of our community. Those willing should be prioritized to receive vaccinations. Ensuring healthcare access to those who need it most during this time of crisis requires an innovative approach.
Health expert predictions are that 4 in every 10 Namibians are infected with COVID-19 as the virus reaches its peak. Government has increased the vaccination rollout, though some districts are running out of stock to administer the second dose. The national vaccination rate for persons fully vaccinated is at a disappointing 1.3% of total population against the overall target of reaching the herd immunity by inoculating 1.5 million people. Blanche Koreses, NBC News.